Hi, my name is Bertrand Dirk, and today we'll be discussing about what cervicogenic headache is. Do you suffer from cervicogenic headache, or think you do, or have you actually been diagnosed with this condition? Well, today we'll be going into greater detail so that you have a clear understanding of what this condition is, as well as understanding what the underlying root cause of the condition is, as well as the potential treatment options to help manage and treat cervicogenic headache once and for all. So, what is cervicogenic headache? According to the International Classification of Headache Disorders, they consider cervicogenic headache to be a secondary headache disorder. This means that the head pain and symptoms originate from somewhere other than the head itself. In this case, dysfunctional structures in the neck, such as muscles, joints, or even discs or nerves, can be the cause of the headache. Through the afferent nerves from the neck to the brainstem, these structures can actually create pain pathways to the head or face. So, what are the symptoms that a cervicogenic headache may suffer from? Now, pain from cervicogenic headache is generally mild to moderate, often unilateral, meaning on one side of the head, and it can usually start from the neck before traveling up and over into the head. So, the pain will mostly be focal around the neck first, and there should also be reduced range of motion of the neck. This will typically mean that you may not be able to turn your head from side to side through its full range of motion. And it isn't uncommon for people with cervicogenic headache to also experience nausea and vomiting. Other symptoms include dizziness, tinnitus, difficulty concentrating, and also depression as well. So remember, cervicogenic headache is usually one-sided. You may usually feel the pain originating from the neck before it travels up and over into the head, reduced neck range of motion, and all the other symptoms that we briefly described about. So then, the next question is, what is the cause of cervicogenic headache? So usually, people may have an injury or a dysfunction at the neck. It could be from having a fall or a car accident, or any type of whiplash injuries can cause pain to be referred from the neck and into the head. However, most cervicogenic headache sufferers have never experienced any trauma like this to the neck, and in these cases, it is usually and more likely that the strain from adopting poor postures is the key contributor. So, for example, prolonged periods of time with your neck forwards, for example, sitting in a chair, using the computer, having a poor posture, will put excessive strain and stress on structures in your neck. Now, the neck can also be incidentally strained from occupations such as looking up at the ceiling like a painter, or looking at a computer all day to one side, for example to your right side, or even sitting down with a poor posture, or you may even have a hunched posture, rounded shoulders, and your head is always poked forwards. Now this can, and over time, strain sensitive structures to the neck, which can then result in cervicogenic headache pain. Now, the atlanto-occipital joint, which is the skull plus the first vertebrae in the neck, and also the atlantoaxial joint, which is the first and second bone in the neck, as well as C2-3, which is second and third bone in the neck, are the joints often responsible for cervicogenic headache. Now, the strained structures will stimulate afferent nerves that travel up into the brainstem, or more specifically, the trigeminal cervical nucleus. In the case of cervicogenic headache, these nerves will enter the spine in the top 3 joints of the neck. From here, the information is then perceived as pain and is referred up and over into the head or the face, which is now commonly called as cervicogenic headache pain. Now, modern research suggests that these upper cervical spine problems can result in a sensitized brainstem, and it is this sensitized brainstem that is then responsible of cervicogenic headache and even migraine pain. So, what are the treatment options and what can you do to help manage this condition? Now, at our clinic, we utilize the most modern research and techniques to assess and treat headache conditions. Unfortunately, not every headache consultant is keeping up to date with the changes in research, which means they may not be looking for the actual cause of your headache condition, and in this case, your cervicogenic headaches. At our clinic, we do thoroughly examine your upper cervical spine and the structure called the brainstem to determine whether or not your brainstem is hypersensitive. Now, if your brainstem is hypersensitive and it is that is the cause, then treatment can begin immediately. So, the question that I would ask you in your case is, have you had your neck thoroughly assessed for this condition? And more importantly, have you had your brainstem assessed to see whether or not it is hypersensitive? If you have not tried this, then I would strongly recommend and urge that you seek a headache consultant to assess the brainstem, which is in the upper 3 cervical spine of the neck. Because if that is determined to be the root cause and the underlying cause of your condition, then treatment can begin immediately. We can only treat if we can understand what the root cause is. So, my name is Bertrand Dirk, and hopefully you have a better understanding of what cervicogenic headache is, and to hopefully seek further help to understand whether or not your neck and the brainstem is the underlying root cause of your condition, and if so, then let's commence treatment straight away. For further information, feel free to comment below or contact us through our channels provided here. My name is Bertrand and I look forward to seeing you at another video. Thank you.